So a fourth person has tested positive for monkeypox here in South Africa. The 28-year-old in the Western Cape returned from a trip to Spain recently. I'm joined now by Deputy Health Minister Sibongiseni Dhlomo. Minister, thank you so much for your time. So a fourth person now with monkeypox in South Africa. Tell us about this latest case.
Thank you and good evening, Sally, and your viewers. Yes, indeed, there's a fourth case of a 28-year-old South African male who has a history of travel to Spain. I'm sure, Sally, you will not remember, just to remind you, when we had the first and second. The third case was also was on the 10th of July in Limpopo. The second case, 28th of June in Western Cape again, and the first case was 22nd of June in Gauteng. So we do report this because we have declared monkeypox a notifiable disease. However, we are not that worried about it in terms of the impact it is having on the society. Again, Sally, you recall we have always been mentioning that one of the legacies we should really have from COVID is that if we actually keep personal hygiene, washing of the hands, very unlikely, Sally, I could be in that studio with monkeypox and then infect you if we do not touch, hug, and my hands are clean, and because it is spread through contact, and we are actually reporting it because it is notifiable. Otherwise, we are not that much concerned as compared to other countries and other sort of continents on monkeypox.
So what is South Africa doing? Is it simply a matter of the health department just saying if someone happens to take the PCR test because they suspect they've got it, we'll note it down? Or are you actually doing outreaches in the community that person has been in contact with, for example, offering PCR tests to other people? How proactively are you monitoring it?
Yes. Minister Pasha is going to give a very detailed briefing on that on Friday, but indeed you are correct. We will also have a monkeypox in this 28-year-old male, and therefore trace the contacts, the immediate contact families, and see that they also could actually be exposed. I mean, they are not exposed to it, and therefore could be subjected to the PCR test, or monitor and see if they are developing symptoms, and therefore if they are headaches, flu-like illness with the blistering dermatitis, I mean the blisters on the body, then that could be an indicative that they are also probably contracting monkeypox.
Of course, other countries have many more cases of monkeypox than us in South Africa, but we're also seeing those countries offering vaccination to certain communities. It happens to have spread in communities where men have sex with men, even though, of course, it's not a sexually transmitted disease. There is a difference. But is vaccination something that we would consider here in South Africa?
For now, Sally, not yet. We would still encourage you, Sally, to talk more about COVID-19 vaccine, because we will not say we are out of the woods yet completely. We may still get another wave, and those who are not vaccinated may not do as well as those who are vaccinated. But for now, we do not have a program to really look into monkeypox vaccines.
All right. So talk to me about the lessons learned from COVID. I mean, obviously it took the world by surprise. Everyone was scrambling to come up with plans. Do we have a clear plan on what we do if another pandemic hits? I mean, God forbid, but it certainly had made everyone at the time talk about the importance of knowing exactly what the protocol should be. Is this something that the health department is actively working on?
Sally, it would not only be health department alone. During COVID-19, we saw a sort of extensive collaboration between both private and public health sectors. There were certain things that we did not have that private sector had, and there are certain things that they did not have that we had. So that collaboration, the lessons learned, we are putting them together to say, what happens if another day we get another pandemic of this magnitude? But the lessons will always be lessons, Sally. You know, this pandemic actually had much of an impactful sort of space on countries that are much more advanced than us. So yes, we may say, Sally, we are doing well, we are prepared for any pandemic come next year, the other year, God forbid. but you may still not be able to say 100% you are prepared to be able to deal with it in such a way that it does not. I mean, it really devastated many countries that are much better off than us in terms of economic powers and also preparedness in terms of vaccines.
All right. Well, thank you so much for chatting to us this evening. Much appreciated. That is our Deputy Health Minister, Dr. Sibongiseni Dhlomo, telling us that the Health Minister on Friday is going to be holding a briefing talking about monkeypox. Fourth case just been identified. It's in the Western Cape. It's a man who has recently travelled to Spain. So that's a sign that it's still spreading potentially from people who've travelled. Of course, we know the first case, the person hadn't travelled.